Welcome back to Retro Cave. I'm your host, Nurse Osman. This podcast, we talk about different health issues, and today we are here to talk about Korea. And as always, I'm always joined by this to discuss these health issues. What's up? May you introduce yourself?
Osman Makangwe, a nurse at the Shore District Hospital and NRI department.
Yeah. So can you tell us what exactly do people mean when we say Korea?
Okay. Cholera is a viral infection. I mean, it's a diarrheal infection that caused by Vibrio cholera, Vibrio bacteria in the small intestine.
So when a patient has cholera, what happens in their body?
Right. This will have the cholera. There is a lot of manifestation. One of them is rapidly water stool. Yes. Especially the stool, they present with it's shown like rice with a milk stick. Yeah. So this person is lose a lot of water, more than 3 times a day. Yes. So we describe the person is having cholera.
Can you describe to us the signs and symptoms of cholera? How does the patient know that? How does the patient know or suspect that maybe they might have cholera? What are the signs and symptoms of cholera?
Okay, as I said, the person can vomit anything that he can eat. He or she vomits. Yes. Also manifested very weak because he or she has lost a lot of water and be weak. You also can have hypoglycemia, which is loss of sugar level in the body. So
Can you tell us how dangerous is cholera? Like the example, like a patient has cholera. What kind of danger does the having cholera pose to a bad patient in their immediate family or friends? What danger does it pose?
alright, so because the cholera is a diarrheal disease, so it's very, very dangerous. Because the patient lost fluids. Because in the fluids there is salts in the fluids, which is very important to human body. There is also irons. You lost irons, which is very significant to the person. So losing fluids in the body is very, very dangerous because a person can die within some hours. So it's very, very important to treat this problem appropriately.
So can you tell us how is the cholera caused? Like how can a patient be in danger of getting cholera? Like
Right. How can person
Yeah.
acquire cholera?
Yes.
It's like that, that question.
Yeah.
Okay, fine. Eating contaminated foods. Yeah, because Vibrio cholerae is a bacteria that stay in the contaminated foods, like feces. If the infected person infects somewhere, maybe the feces has contaminated with the food, so someone has taken that food and chew, so you can get that Vibrio bacteria. Also through contact, if you have contact with the infected person, I mean infected food, you can easily get that disease.
So can you tell us what are the treatment options available for cholera but you know?
Okay, it just depends with the severity of the cholera.
Yes.
Because there is a different type of cholera. Yeah. So some cholera some mild and severe. So mild is a person who just have a thirsty. Yes. So we treat it differently. Someone with mild malaria, mild cholera, we treat with we just replace the fluids like take water, treated water, yes, or automatic rice, or hydrated salts. So we give the patient to replace the lost fluids. If the cholera is severe, we consider to give the antibiotics and the intravenous fluids. Intravenous fluids is fluids that we give to the patient using cannula and IV lines. We replace them. It's commonly known as drip. So we give it. We replace the fluids using intravenous. Also, we give antibiotics, different antibiotics according to the age, because we give the antibiotics according to the age. And adult and children with different treatment.
So can you explain us when a patient is treated for cholera, how long are they required to stay in the hospital?
All right, so it just depends. With mild cholera, I don't stay. It's either 2 or a day. Yeah, when you treat, it's treat and go. It's like the OPT patient, OPT case. But if it is severe, we don't have specific dates or hours. That is pure. It don't take time, a lot of time. It's within some days.
So when a patient thinks they have cholera and they come for a checkup, how are your checkups conducted? The patient think they think they have cholera and they want to come for a checkup. How do doctors perform those checkups to identify if this person indeed has cholera or not?
Okay. Like investigations. Okay. Like patient is sick.
Yes.
Is losing fluids or is it like hydrated? So it's come to hospital to identify this is cholera. Okay, we test. We use we send the patient to the laboratory to test the specific bacteria. So if we found that this is a causative agent for cholera, so we come up with this is it. Cholera. Yes.
So I've heard some people take salt solution for treatment of cholera. So how is salt solution helpful for treatment of cholera? And what actually role does salt solution play in cholera treatment?
All right. Tanzorize. Would help to replace the lost fluids. Because the one who is suffering from, who is sick, who is affected by cholera, who is having diarrhea, lose a lot of fluids. Because losing a lot of fluids is very dangerous. So ORIS is there to replace the lost fluids. Yeah.
Can you tell us, since you've already told us about treatment of cholera, so can you tell us the actual medications, but the medicines that you know about helping with treatment of cholera?
The action.
Yeah.
There is a decent doxycycline.
Yeah.
There is also azithromycin,
Yeah.
and there is ciprofloxacin. These are the antibiotic.
Yes.
Yeah, that are given to someone who is cholera, who is affected by cholera. But the ciprofloxacin is only given to adults. Yeah, I can't give it to children. So because this topic is generalized, we I'm answering to either children or adults.
Yes.
So adults we give ciprofloxacin, azithromycin, and doxycycline. So also we treat if the patient has come, we have given the antibiotic. We also treat the person who is a caregiver, even as no cholera signs, but we give the doxycycline once. Yeah.
So let's say like for example like the person doing like we have cholera, what are the main effects that happen to them, and how can like the pregnant women like how can they protect themselves from like getting cholera?
Okay, I have to proper hygiene.
Yes.
Is very vital. We encourage them to practice proper hygiene, taking food that are already treated, who are well cooked. We discourage undercooked foods. Also discourage another pregnant women. They are fond of taking soil. So also discourage that taking soil. Also, we also give them ORIC. Yes. It's like prophylaxis.
So let's say when a patient has cholera and we get treatment, let's say that we are like at home, how can they protect themselves and their family? Like how can we not transfer cholera to like our being?
All right. Best thing at home at community level, have to isolate the patient who is suffering from cholera. Have to isolate him or her. Should stay to the room that is high alone room. Yeah. So that's what I say. Isolation, and also should put on the protective equipment. The one who is handling the patient. Yeah.
So say he put on
Like gloves, aprons,
yeah.
and masks.
So about the mask, what type of mask should like based on certain cholera have to use? Because when you say mask, like, many people can just take any different mask or it's very specific mask.
Very specifically to prevent other from contacting cholera because it's contagious. It's will give through poor hygiene, and contaminated foods. Best thing is to proper hygiene. Yes. Before you handle anything from the patient, you have to wash your hands using soap. Even without face mask, because it's not air dropped. We not sprayed using the air. We contact the disease from the contact. Contact. So best thing is to wash hands thoroughly using soap. So before come to contact with if either the cloth of the client, of the patient, rather, you have to wash hands, wash your hands. So proper way to treat, to prevent is proper hygiene.
So
Sanitary water, well treated water. Yes.
So, do you know which is the most vulnerable group but the are affected by cholera?
Most vulnerable group.
Yes.
Most vulnerable are children, because uh, children and adults, elderly. Yes, those are vulnerable. Also, those people who are who are like primitive area where there is no boreholes. They take the water from wells. Yeah, those are vulnerable group people. Those who are not practicing hygiene. Yes.
So, let's say a patient has been treated for cholera, and then after some time the cholera, the kid cholera came. So, what happened to the patient? Right. When you have treated the patient for cholera, and then they have been healed. Then after some time, since that was the cholera started acting. So, how do you approach the bad bacterial situation?
Oh, so if they treat, we had a patient
Yes.
has been treated,
Yes.
and has gone home,
Yes.
sent home,
Yes.
and then has come again with this type of cholera as well.
Yes.
Okay, we treat. We just change the treatment.
Yes.
If we give information that it has happened again, we give another treatment like information.
So, let's say after when the patient comes to the hospital, so like sometimes how what are the methods of it? What are the methods or rules of you follow like for treatment for example in before they do they have to be isolated or like do they just just each one is on different days or do they have to be on a like do are they in a separate room or can they just be on the bed?
Any patient who is suspected to have cholera, we separate him or her. He stay on her own room. Yes. After separating him or her, we hydrate, because most of them they are dehydrated people. They have lost fluids. They have lost fluids. Skin tank goes back in later. Like when you pinch the skin, eh? For it to come back to be normal, it takes some time. Yeah, within some maybe more than 3 seconds. So we conclude that this patient is very dehydrated. So we rehydrate first. The first thing is to isolate the patient. Second thing is to hydrate. We request the lost fluids, dehydration. Yeah. So in the hydration, like I said earlier on, there is oral IV fluids. We give fluids using IV lines, ORIS, orally. When the patient is not can't be able to drink, to take food on her own, we give the IV lines. Then when we test it, after some hours, we test that you can be able to take food, to take fluids using mouth. We give you ORS. Then so when we give the antibiotic, but the patient, we separate the patient until we send back home.
So for when the patient changes treatment, are there any specific foods that can help in battle cholera and what are the specific foods that this specific food play in battle cholera?
No, there's no specific foods, but what we encourage is the fruits, taking water, because all the demonstrate the patient is lost fruits, lost water. So our main emphasis is to repress the lost fruits and to terminate the causative agent. So as why we give antibiotic. So we don't rush to antibiotic, yeah, before the first time we request the loss of fluids, because losing fluids is mostly dangerous. The person can die within hours.
So, like,
There's no specific kind of foods like you should take this, no, but the best thing is to practice hygiene.
so can you tell us, do you know, like, that way there's a changing in way for affecting the possibility of getting cholera? Like sometimes, like for example, with the inhabitants, there's this a factor in getting cholera.
Yes, it has, because during rainy season, there is a lot of um, that is, I think it's urgent. Yeah, because a lot of people, mostly during that time, I saw when the cholera cases increased.
Yeah.
I think it brings a lot of because there's an hygienic condition that's taking place during those rain season. So because of that, it's where a lot of people can contact the yeah, they can, a lot of people practice the unhygienic.
So,
That is why.
so as a health official, how do you ensure that you teach your patients or people around the community about the danger of cholera?
How do we show?
How do you teach about it? How do these patients or like people around the community about the danger of cholera?
Any season or the season that any season.
Yeah, anything like that. How do you teach people about cholera is dangerous? How do you teach people? Or what are the methods that you teach people about the danger of cholera?
Public campaigns. Now we send at the community level, there is yeah, those people they teach that at community level the signs of the cholera. So when they see these signs and symptoms, rush to the hospital. Yeah, they teach the communities. Also, they teach how cholera spread. So if they see such a manifestation to the patient, maybe they should do what? They should do the first aid management, which is isolate the patient, or else they, as I said, they have to rush to the hospital. Also sometimes we as the nurses, we go there at the community, more especially if we have observed that this area there is a lot of cases of cholera. We go there and teach the community how the manifestation and how they prevent the proper hygiene, for sanitary water, like adding choline in the water. Such a kind of.
So far we have come to the end of our program. Thank you for your time. So as you have seen, we have discussed many topics about cholera, and I hope today we have learned a lot of stuff to help us in preventing cholera. As always, I've been your host, Nurse Osman Makangwe. So until next time, see you in be healthy.